just so that I'm clear, the rupturing of the membranes and removing the fetus, that is a method, as against aspiration being a different method.
I believe so.
Okay. And then how would you, is there a shorthand you would use for the rupturing of the membranes and removing the fetus?
Objection. Misstates her answer or testimony.
Well, the broad rubric of D&E would cover both of those methods, so I'm not sure what you're asking.
Okay. Okay. Well, I didn't know if there was a shorter way to describe rupturing the membranes, removing the fetus.
They're both D&E procedures.
Okay. And are they D&E procedures because they are performed after 12 weeks gestational age?
Well, D&E stands for dilation and evacuation, and you can dilate and evacuate with suction, or you can dilate and evacuate with curettes.
Okay.
Or forceps.
Okay. And then, in terms of changing in terms of the technique, so we had talked about techniques. You had said that your thinking had evolved on changes in techniques. If you could tell me, when did your thinking begin to evolve on changing of techniques that you had referenced earlier?
Sometime, evolution is a process, as we know. I would say that when I was at PPLA, there was question marks about whether it was permissible to obtain tissue by using different techniques, because the legal regulations were not at all clear, and nor did they define things. By the time I was at PP Pasadena, many of us were moving in the direction of making this distinction between method and procedure and the method and technique. And so I was very comfortable at that time that the difference in technique doing a different technique, say aspiration versus manual aspiration versus electronic aspiration, did not really affect the procedure or the method, so was therefore permissible in terms of fetal tissue donation.